Hi, this is Rebecca Williams and I'm doing the wound care. So the first thing I would do if I had someone who is injured is you could have them grab onto sterile gauze pads and have them put pressure on the wound. So take that and put pressure on the wound. I'd have them do that after I'd clean my hands and while I was putting on gloves to help control any bleeding there might be. I'd also have them, if there's more bleeding, just raise their arm above their heart until the bleeding stops. Once the bleeding stops, I'd have them remove the pad, the gauze pad. Okay, so if there was stuff in the wound, I could just take the iodine stick and putting it in the center of the wound and going out to remove all the dirt or anything that might be inside the wound. And then I would just clean around the wound. Once I had finished cleaning the wound, I could put on steri strips if they were needed. And do this by pulling this apart. Moving the ends. So I would start at the bottom and I would spray first tape adherent on either side of the wound. And then I would place the first portion of that on where I placed the what is it called? The tape adherent. And then I would pinch the skin inward and place the strip down. So I would continue to do this up the wound. Pinching each time. After I was done going completely up the wound, I could take a non-adherent pad like this, and I would just place it right over the wound, and then I would just wrap it up with elastic tape. That's it, right? And then I would safely remove my gloves and throw all the biohazardous material away in a special container.